Help is available.
Treatment works. Recovery is possible.
The way that I see addiction treatment changing in the future is that it will need to become more integrated. We'll need to integrate more with mental health and primary care and other disorders, that will continue to grow as an addiction profession and share that knowledge, and also share clients who have several disorders that they're working on at the same time.
And creating this new industry, if you will, of recovery coaches does a couple things. Number one, it serves the client, the person that is better respected now for being a client rather than a helpless individual. And through peer recovery services, the transfer back to the community is made much better. But at the same time, it's made people in the recovery community who do peer work partners in the overall industry. Not only has that changed the field for addiction recovery, it's changed the field in the mental health recovery. The diabetes community has found that's a good process to have. And so in all these cases, the impact of people in recovery willing to stand up and demonstrate recovery, but also reach out that helping hand to the next generation and do it in public, where people can understand it's a normal human thing to want to be connected.
Recovery Month offers the community an opportunity to embrace the concept of recovery, to recognize that people can and do recover. It offers the individual an opportunity to see that other people are in recovery. So Recovery Month operates at the level of the individual's family, and the individual's community, because it also lets the family know that they can hang in there, because often people who experience substance use disorders or people who experience severe mental illness can tax the strength and the willingness of family members, because they, especially when you're in the throes of the acute effects, you don't see any light at the end of the tunnel. Recovery Month actually points to the end of the tunnel and says people do recover.
The Entertainment Industries Council is really an outreach component that helps get the message out about addiction and recovery, and does it through a multitude of media outreach. First is our PRISM show, which is addressing the accurate and authentic depiction of mental health and substance abuse within the entertainment programming.
And one of the most important aspects of that has to do with moving from an acute model of care to a chronic model of care, recognizing that addiction is a chronic condition. I'm very excited about some of the research that's happening in that area, so that we can ultimately help influence how prevention and treatment and recovery occurs in this next several decades.
A workforce that has the language capabilities and the cultural competence to provide effective substance abuse prevention, treatment, and recovery services requires the training, recruitment, retention, and promotion of Asian Americans, Native Hawaiians, and Pacific Islanders into our field, so that they can help provide the necessary services in programs, reaching out to our populations through traditional treatment programs, as well as innovative techniques using technology such as telemedicine techniques across areas where those services may not be available in their local communities.
Social media is only one tool, but it's a tool that can be very helpful, because it's a tool that can repeat what a teacher might have said.
So to help train school personnel, counselors, other administrators, how to recognize the early warning signs and concerns around mental health and addictions, and then help link people up, children and families, up to needed services and treatment.
So in 10 years' time, if we're really going to talk about having affordable and accountable care, it should really account for the care of the person, so that you get that professional help, whether it's one-to-one, the group counseling, where you can start to build trust and move it on into that outside community.
I think we're going to be a vital part of policy making over the next 10 years. I think we're going to be a vital in assuring that the criminal justice system may, hopefully change a little in looking at addiction as a disease, and understand that people do get better and recover, and that we need to provide the supports for people so that they can be successful and well in their journey of recovery.
I would love to see a beautiful landscape of the treatment movement really embracing people in recovery as clinicians, as peer coaches, as part of the treatment process. I don't think there should be such a divide between clinical treatment services and peer services.
When you see an individual that is in recovery, providing peer services, giving back to their own community, plus giving back to their broader community by serving those in the recovery community, it's amazing, and I think that is the future.
The importance of Recovery Month is that it symbolizes hope. Without hope, there's no recovery. So Recovery Month embodies that hope for change, that hope for a difference, that hope that individuals realize that there is something for them, that there is possibility. Because of that, they can seek treatment, seek support, seek other people who are in recovery to continue that hope.
The U.S. Department of Labor estimates that as of May 2014, there was approximately only one counseling professional for every 250 people with a substance use disorder. So it is clear that we need to redouble our efforts and create stronger incentives to attract more professionals to join and remain in this field.